So this is number 9, some radiolucency above. This is pretty much about a 4 by 4 millimeter across, so I decided to go ahead and do a retreat on this one. There's a post, there's a little bit of overfill, got a percha. This is 2 years ago, and this is my final, after I took the post out, and this is a 2-year follow-up, so it's healing very well. This is a probably about a 60-year-old Hispanic woman that came in, really nice lady. For tooth number 30, she has some issue with this tooth as far as chewing and percussion sensitivity. So went ahead and did the root canal on this in January. This is in January I did this. So you can take a look. There's some lateral canal filling here, and then there's a lateral canal on the distal. So she comes back a couple of weeks later and says, I'm still having some problem with this tooth. And I'm looking, what could be the problem here? Everything looks good. Like, okay, let's retreat it. Usually if they come in, with sensitivity, it could be either a fracture or fourth canal or something along those lines. So I went ahead and did a retreat on her, and look, there's a lateral canal. And she came back probably about 3 times before I could actually get this. Finally got it, and she was fine. She could chew afterwards. So all the sensitivity from chewing because of that little tiny lateral canal. This is also an Eastern European gentleman that came in 2 years ago. Look at his x-ray, and there's a little bit of an overfill. I don't think it was overfill originally, but if you take a look at the apex, the longer the preapical radiolucency stays around, the more of apical resorption you're going to have. So I'm sure the apex was way up there, and it just kind of got resorbed down. And it's kind of close to the sinus, so I was kind of careful, but it's a big post, so what are you going to do with this? And I thought, okay, well, let's do an apicoectomy on this. Here's my apico with MTA right here. And here's a 2-year recall on that. This is also another interesting case. Patient came in. He was one of those guys that says, I have a guy in Sacramento who's a buddy of mine, and he's a dentist, and he did this root canal for me back there, and he did a great job, and I want to make sure you do a great job too. I'm like, okay, fine, just sit down first, And I look at number 31. It's not the greatest root canal, but he had a problem with number 30, so I'm like, okay, let's go do number 30. So we did number 30, and then looking at this x-ray, you can see that he actually has some separated file on that number 31. So his buddy really did a good job on him. Here's my root canal. There's a lateral canal filled on the distal. Here's another angle on that. This is a 1.5-year recall. See all that radiolucency around number 31. If I go back to, or 30, yeah, all that radiolucency is gone. But look at number 31. This is one of the worst vertical root fractures I've ever seen. And it kind of looks like it goes all the way to the distal right here. And you got some radiolucency all the way up here. The separated file is hanging here. It's probably going to get into his bloodstream and die. I don't tell him that. But he comes in, he says, I'm still having some problems here. I'm like, well, look at number 31. This is your problem. This is a vertical root fracture. I'd show him on the laptop. Look at this root. And I showed him before. He says, no. This is the other tooth he did. So, needless to say, he wasn't too happy when he left. I'm like, well, I need the other tooth out.